progress.
Good afternoon, everyone. I'm just going to wait a few more seconds for the rest of the participants to be invited into our presentation this afternoon. Well, good afternoon, and welcome to this month's conversation with Sally Kirshner and Elisa Stahlberg from the Vermont Department of Health. I'm Brenda Metzler, Community and Program Support Specialist at Let's Grow Kids, and your host for the next hour. We are pleased to be able to host these monthly conversations between Vermont's early childhood community, all of you, and the Vermont Department of Health. A couple of housekeeping things. Please type all of your questions into the Q&A box. That really allows us to capture them and to make sure that every question is answered either live or on the Let's Grow Kids website. Also know that the slide deck and a recording of today's presentation will be posted on the LGK website within the next couple of days. I'd like to lead with a personal message to you today. This period of emerging from a state of emergency caused by the global COVID pandemic may seem fraught with challenges, but I invite you to remember who you are. You are early childhood educators. You are creative and resourceful. Every day you show up with a plan and the knowledge that you will most likely be adjusting and adapting your plan throughout the day. You have creatively and resourcefully come through the intense cleaning protocols and the special pandemic guidance, even when it changed from month to month for the last 15 months. You are committed to the children in your care and to their families. And as you emerge, as we all emerge together in this sort of new space, you are already generating creative solutions to welcome families back into your programs. And I'm pleased to tell you that we're going to post some ideas in addition to this slide set on the Let's Grow Kids website about ways that folks have been sharing with us that you're creatively welcoming families back into your program. So now I want to just say again, welcome to Sally and Elisa, and I'm going to turn it over to you, and I will keep an eye on the Q&A box and check in with you again when we get to the question period. So thank you, Sally and Elisa, for joining us today.
Right, hi and welcome. And I'm Sally Kirshner. I've talked to you before with my colleague Margaret Tarmy, who's unable to join us today. And we have Elisa Stahlberg, who is our MCH Division Director. And Elisa has been in the thick of this, as you all have for these last 15 months. So it's great to have her on to help answer questions and hold this and keep the conversation going. So next slide. So a little bit to reflect what Brenda just said, this is just great news about the formal lifting of all the COVID pandemic restrictions and working kind of quickly to go back to normal operations. But it is a little confusing. And I want to especially shout out to you folks who have been in the thick of this on the front line with all these minuscule but very important procedures that you've been doing every hour, every day for the last 15 months. So it might be a little odd or uncomfortable to go back to these normal procedures that, so it's a good thing that we're able to talk today. My computer screen's blanking out. Elisa, don't laugh at me. So we're going to just the next couple slides just talk a second about where we've been and then how we're moving forward. So next slide, please. So this slide wasn't too long ago when we were looking at this really very seriously and focused on all of this, plus all the guidance and recommendations and CDC and national. And next slide, please. And worrying about drop off and pickup and vaccine and health screenings. And this is in a, basically we don't have to do this anymore. Enough of the population has been vaccinated, and we feel we have enough protections in place with the universal precautions as put forth by the health department, the governor, that we can work very quickly to go back to normal operations for businesses and schools and for folks like you. Next slide. So I'm sure you've been in on the skinny on this. We were all going to go to, hopefully by July 4th, to get to step 4, but actually we did it on Flag Day, June 14th. So I'm sure you know, the governor declared all the restrictions lifted, the official executive order ceased at midnight on Tuesday. And that's because we got to the goal of 80% of Vermonters who are eligible for a vaccine. For example, they're 12 years or older, and they've all had, 80% have had at least one dose of the vaccine. So that was the governor's goal, and there we are. So what next? Next slide. So as I just said, this, and you can, a lot of good details are on the Vermont Forward Plan of the website of the governor, and I know that because I was on it a lot getting ready for this presentation. But here is kind of a summary of where we are at step 4. The guidance encourages Vermonters to wear masks and practice social distancing if you don't yet have your vaccine, and be cautious about traveling. Like, for example, don't travel unless you're fully vaccinated, and be cautious about where you're going. And there's more, especially internationally, there's a lot of guidance on the CDC website. And also good hygiene. And I'm going to talk about this a lot because this is my favorite topic, is lots of hand washing, and you folks know all about that. So the universal guidance is now in place and encouraged for business sectors. Businesses can do their own rules. The governor uses that analogy of, like, you see in a lot of businesses historically, no shirt, no shoes, no service. They can add no masks if they want. And that's how, and they're free to do that for their own business and how they would like to progress with their own business practices. And the restrictions on, how many people can be in a restaurant or sit on the sidewalk or go to graduation, that has all lifted. Okay, now next slide. The masking and physical distancing has been a lot of conversation. The mandates are all lifted. Again, as a health department, because we don't have the executive order, we can't require masks. But on the other hand, a lot of how Vermont has approached this and how you folks have done it on the front line is just a lot of information and encouragement and education to encourage masking, vaccinations, and following the other recommendations throughout these many months. And that approach is continuing. And that's actually what we here at the health department do traditionally in encouraging healthy behaviors. So the third indentation there, the masks are recommended for unvaccinated youth in childcare and summer camps, and also during indoor activities for unvaccinated people. And then we were just getting a few emails this morning that help us clarify. It's still there's a federal regulation or federal statement in place that masks on public transportation are still required. So we were thinking if that I don't know if you folks are using like school buses and that sort of thing for any summer camps or summer activities, then the masks are required for children and unvaccinated people on those trips. And that's on this link here and on the CDC website. Next slide. And I think you all have seen this, the email or messaging from CDD as of a few days ago. And it's kind of what we're just gonna, this is like the mantra now. Unvaccinated people, children under age 2, and unvaccinated adults wear masks. It's recommended, it's encouraged. When inside throughout the summer, childcare providers need to decide how they want to proceed in their own programs. Are encouraged to have conversations with their staff and their families, communities, to see how they would like to proceed with this theme or this frame of universal precautions. There's more information at the health department's website, which you all know that anyway. And this is kind of like a summary. That email kind of said it all. We usually throw in these presentations some data, and the health department, we have the data available on our website, as you say, and it's always interesting to look. I didn't include it here. There's a map of the different counties and towns and vaccination rates, which is interesting to look at. But we have that magic number of more than 70% of eligible Vermonters have received at least one dose. And you know, the Johnson & Johnson, as we know, is one dose. So, and the other Pfizer and Moderna are 2 doses. I always like to look at the case positivity rate in Vermont. It's 0.7%, which is less than half of the national positivity rate. So that's always reassuring that this data indicates how well Vermont is doing. And then here, as of just, it was today, this was yesterday, the latest percentages of children and teens who've been vaccinated with at least 1 dose. So that's of interest. And next slide. We talked about this at others of these meetings, that the vaccines continue to be safe and effective. The research is constantly being looked at with this. And again, I hear the experts, I listen to those webinars from Johns Hopkins, or you're hearing Dr. Fauci on NPR or other radio stations and TV, and the experts are just amazed at how effective these vaccines are in the high 90 percentile of people who become immune after receiving the vaccination. Of course, with any vaccination, there is something called the like a breakthrough infection, and the person does get the disease, but this is very rare in Vermont. As we've been tracking this, less than 1% of the cases have been among vaccinated people. And again, to kind of now, since we're past the urgent pandemic phase and going into like COVID as one of our, I don't want to downplay this, but we're starting to look at COVID in many ways as one of our important ongoing diseases. So that means we're going to have vaccine for it. We're going to have boosters. We'll have a few breakthrough cases. And we'll start treating it like measles, flu, that sort of thing. Some of the ongoing disease management, public health efforts are starting to kick in. And like Elise and I would know that from working here at the health department. And then that's one reason why you guys are in shock and disbelief that you can stop so many of the guidance and the procedures you've been doing for over a year. Okay, next slide. So this is good news too, that we have this issue of these unvaccinated, these younger children, what to do with them with masking and spacing and in the childcare and outdoors. And but hopefully that will be only a couple more months. By the fall, there'll be a vaccine, we hope, for children ages 6 to 11, and then by January for under 6 years. And then this will start looking like regular vaccination programs for children and adults for COVID-19, like we do, like with kids with measles, kids and adults, I'm thinking tetanus shots, flu of course is incredibly important. So we're starting to move into our normal disease management with vaccine preventable diseases. And childcare programs, you still, I didn't mean to imply that you don't anymore. You have an ongoing, incredibly important role in modeling disease prevention and in such things as cleaning and hand washing, and also encouraging your families to get their children vaccinated, the children that are old enough to get the vaccine now, and as the vaccine comes up, to just constantly talk with your families and make it feel normal that their kids are going to get vaccinated for these vaccines. And of course, many of the families are very willing to do this. We've talked about this too. Vermont AAP did a series of family forums in various areas around the state in the last couple of months. These are recorded and available at the AAP. Just type in Vermont AAP and the site will come up and you can see where the videos are. And these were done by local pediatricians and they're very good. So you can look up the pediatrician for the area closest to you. I'm thinking if you're finding a lot of families who want more detailed information, you might want to contact that pediatrician and say, can you do like a special session for us? I don't know if they're able, I can't speak for them, but that would be an idea because these physicians and their practices were really very eager and willing to do these videos about vaccine safety. Okay, next slide. Oh, just to reiterate, this is Margaret Tarmy's slide from last time because she put that funky Jeep or whatever it is up on traveling through the mountains. You know, to go back, there are stages 3 and 4. Last summer, you guys were quarantining the kids who went to the Boston Aquarium and came back on Monday morning and all that great work. Well, we don't have to do that now. Might still feel a little funny. We haven't had to do that for a while, but there's no, you don't have to wait 3 days and get a test. You don't have to be quarantined when you come back from another state. International travel is very different, and that you should check on the CDC website. They have all the recommendations for the different countries, and it's constantly changing. So that's a nutshell of the travel. Next slide. So this is again back to, we're in step 4. Our great partners at the American Academy of Pediatrics put out a statement. I have the link here on their website, and it talks about, I've just put in a few phrases from the statement. Vaccines are the most effective tool we have to end the pandemic. And you've also heard the more people are vaccinated, the harder it is for the virus to mutate and for new variants to be formed, because the virus has to be transmitted between one human to another to be able to mutate. So if they can't transfer to another human being because they're vaccinated, then that tricks the virus. So the AAP is saying case rates, hospitalizations and deaths are incredibly decreased thanks to these vaccines. And then that you folks are right in the forefront that young children are not yet eligible for the vaccines and so warrant a special consideration. Here they're saying what we've been talking about, families in child-serving settings need to make their own decisions. AAP Vermont, I will say the local pediatricians are there to assist you with decision-making, but these are the recommendations. Unvaccinated children under 2, as well as unvaccinated adults, should continue to wear masks indoors when they are around other unvaccinated people. Low risk of transmission during outdoors, they don't need to wear masks outside. Next slide. And there's more from our partners at AAP talking about the effectiveness of masks. And then they're talking about, this goes back to your general practice, like there were some questions about when a child is sick and about how to, or has symptoms and letting them into the child care program for the day. The pediatricians have noticed really decrease in these types of infectious diseases and children being admitted at the hospital, like the RSV and flu. Then as the restrictions loosen, they're starting to see, at least worldwide, more of these respiratory viruses being transmitted. So actually here in Vermont too, they're talking about a little bit more increase in the hospitalizations, which we weren't seeing during the height of the pandemic. So this is getting at, let's continue with these good practices, and how you decide in your in your educational setting, how you want to work it, to talk to families, talk to the community about general infection control. And where I'm going with that is that masks are one thing, but you do a lot of other things, such as, I remember in caring for our children, there's, you know, the recommendations for routine washing of certain items and the toys and the blankets and the sleeping bags, et cetera, and hand washing. And I think that's one of the major reasons, or one of the major mitigation efforts. And in schools and in workplaces and in childcares, all this good hand washing we've been doing, that should be continuing. And also, as always, the family's medical provider can provide more advice too. Next slide. I'm getting ahead of myself here. So this is a bit of a summary that unvaccinated children under 2, as well as unvaccinated adults, we're encouraging folks to wear masks indoors. Since we don't have our executive order, that gave us the legal authority here at the health department, at the Agency of Education, and at CDD to have a certain legal authority to say things must be this way, but that's not there anymore. So that's where we're relying you again. We're always relying on you to figure this out on the front line, see what works for you and your families. And we can give public health advice, but we can't mandate things now because we don't have an executive order. So as you found out, the CDD guidance has been discontinued, and we encourage you to continue with the practices and policies that make sense, use best practice, follow the CDD regs, and are also follow the caring for our children. And again, I'm thinking hand washing. So you may have known that myself and Margaret and Sharon Lee Trefway, some of you may know her. We have our new staff person, Caitlin Kotz. Several of us have been on the phone on this warm line that you can call and ask questions. We've all been discontinued. We've been demobilized. So we're not there anymore. There's a slide at the end that explains this. So our phone line isn't there anymore. Our email isn't there anymore. And we're not helping with the contact tracing anymore as health department employees. The health department has contracted with an organization called AM Trace, and they have specially trained contact tracers who are doing the contact tracing for Vermont. So if there's a case in a childcare, a case in a workplace, a case in a hospital, these contractors from AM Trace will be following up. Then they may call you if there's a child who is positive, just as in the olden days, a child who is positive and was in your child care while infectious. So you may get a call from a person you don't know, and they'll identify themselves to make sure you know they're legitimate, but that's how we've set up that process. Okay, next slide. Oh, we're to the questions. All right. And then, Brendan, you folks are monitoring the questions. Let me go through these questions, and I think they might deal with some of the questions I'm seeing in the Q&A box.
Right.
Yeah. So the transmissibility of new variants in young children, and the answer, we've talked about this some, and it's good to keep asking this question because there's always new information to help make this answer more complete. But variants can be transmitted in children and adults. If you're fully vaccinated, the vaccines are effective against the variants. I was just hearing the new Delta variant. They're starting to call it, ABCD, so that it's a more scientific way to identify the types of variants. But the vaccines still are very effective against the variants, and they're finding that it's most effective if you have 2 doses. If it's a vaccine, Pfizer or something that you're supposed to have 2 doses, it's even more effective with the 2 doses. Elise and I were talking about this morning. Some parts of the world, they're still looking at trying to stretch the vaccine. And if it's 2 doses, they give the whole population just 1 so they can stretch out their available doses. And that is not as effective as these new variants are coming out. So that's something that world health leaders have to figure out the risks and benefits of that. And we have the variants that's identified by the health department in our lab by the genome sequencing. That's on our website, which is a little scary, but a little interesting to watch and follow. Next slide. Oh, this is singing. So this was a good question because, well, there's not a straightforward answer, as we've all gotten used to that, but this is an example of what you folks will be coming up with. And then you look at the universal guidance of masking and vaccinated people and unvaccinated people, and how do you apply that to something like singing in the classrooms. And two really obvious things would be to encourage anyone who's eligible to get vaccinated. If you can hold the singing session outside, that's even better. I know you guys learned that long ago. And then to look at the indoor space and see if, back to maybe some of the practices, a little bit of distancing or wearing masks, that you could put in the mix too, as you look at your individual situation to see which is the best way to work this situation. So next slide. Oh, and requiring staff to be vaccinated, that as a public health person and as a health department, we can't really speak to that. It's kind of a legal question, or if, I don't know if any of you, obviously larger organizations have their human resources offices. Maybe some of you have access to that. So I can't quote the law to you or whatever. And so I don't have a straight answer for that, but the other part is, as much as possible, make it easy and comfortable for staff to be vaccinated. Our commissioner talks about talking to people about, well, why don't you want to get vaccinated? Well, I've run out of sick leave, or I'm worried about if I get my vaccine on Friday and I'm sick on Saturday, and that's why I needed to do something, to try to work around some of those concerns. But some people really do have personal reasons for why they're not vaccinated, and that might have to go to some legal advice as to how to handle that. Next slide. Right, this was unvaccinated adults pose a higher risk of transmission to infants and toddlers. So this is a good question to remind us that that's one reason why we're all really encouraging all adults to get vaccinated. So the answer is yes. I think next slide. I think there's another question dealing with this too. There was some talk when the vaccinations were first coming, this is like 6 months ago, about if you're vaccinated, but can you still pass it on? You wouldn't get COVID yourself, but you might be carrying the virus in your mouth and nose and sneezing and the aerosolization, and you could spread it. But now we found fully vaccinated people do not have to wear masks. They're not in danger of passing it on to other people. So that's some of the reassuring research that has happened over several months. Next slide. Oh, and this is the, Brenda had sent and reminded me about this regulation, which I had to say I'm not up on the childcare regulations, but legally parents have access to the programs. And since there's no executive order with all the guidance and regulations and all around COVID, you can start going back to your pre-pandemic practice of working with parents when they come into the program to see their kids or to participate in projects, parent nights, that sort of thing, that the parents, back to what you usually did, your usual visitation policies. So that would be another example of returning to the pre-pandemic state. Next slide. various viruses. Yeah, and yeah, I like that. The viruses are sneaking back in. They're clever little buggers, aren't they? So again, to go back, and you folks have a whole set of strategies and tools to minimize infectious diseases in your program. So just go back to pre-pandemic and look at them, see what you were doing, what did you enhance or do differently or did more rigorously during the pandemic, and how did that feel and work in your program with your staff and your families. And you might want to do a reassessment of everything, make sure everything you're doing is with CDD regulations and caring for our children. And this is a poor example, but maybe if you wash the kids' hands 3 times a day, you might want to wash them 6 times a day now and continue that. The hand washing, we're all focused on the masks, and that's important too, but the hand washing is so important. And I realize the kids are sneezy and they touch their nose and everything, but lots of hand washing would be something I would say to keep as a really frequent and regular practice in your program. So there's an example of how you would continue to model for families about good health and disease prevention practices. And also, as it says in caring for our children, and if the child is sick or your staff person is sick and have symptoms, they need to stay home. And this is a big conversation in workplaces. It's here at the health department. We think we're indispensable when we come into work when we're sick, and we're all saying to each other, we can't do that anymore. And you folks will need to be thinking about how to create that kind of a culture in your childcare program. Next slide. Oh, yeah, this is the most important slide. This is like, thank you to all of you for all of your work in the front line. And Lisa and I were talking this morning and remembering how you folks just really stepped up to the plate in March of 2020. And in other states where all the child cares were closing, you didn't. You continued, you figured it out. I think Brenda used the word creativity, imagination, hard work. You take what you know and you applied it. And we at the health department learned so much from you when you would call in and ask us the questions. And we're like, oh, we hadn't thought of that. Or, oh yeah, that's a good idea. We better do that. And we'll put that in our guidance. And this back and forth, and you folks out there in the front line have been such a critical piece of this whole Vermont pandemic response. So we at the health department, thank you so much. So, yes, way to go. We did it. You did it. So this is great. Shall I look at some of the other questions or chat? Oh, wait, here's the contact.
So I'm happy to sort of maybe do a little grouping for you. There were a number of questions about good health practices moving forward. And one of the things that I have heard you and Brina and others say routinely is that, we learned some really helpful things through the pandemic and through the health practices that we had to implement. And so continue to implement ones that make sense to you. But I'm just going to read a couple of the questions here for you. Could new best practice illness recommendations that reflect all we've learned be sent to the CDD and AOE? So people are thinking about this. Yes, we have learned. We're in that awkward space right now where there aren't any pandemic guidelines or mandates, but there are best practices. And so just people seeking clarity and around what's best for their program. And I think it's important to note that some of these things are going to be individual business and or program decisions. And let's see, we had, okay, so our child exclusions to stay the same, and In other words, excluding for runny nose, cough, temperature of 100.4, et cetera. Yeah. So anything you'd like to say about those remarks or those questions?
Right. So the child exclusions, that would be what folks did pre-pandemic, which I think is pretty similar. And we talked about being a little more rigorous too, because I know we all kind of like, oh, it's a little runny nose. He's had it for 4 days. Just let him in. It's so tempting, especially when the parents are out of leave or they'll lose their salary if they stay home one more day. So that still is part of the guidelines and part of the caring for our children, that they should not be in childcare. And it's easier for me to say that, but that's the overall theme that should guide this. And that was the specific algorithms and everything that we developed. Those are, I think, they're not being rigorously applied now because we don't have the executive order, but they're still being used by, if a child starts to have symptoms and the parent calls a child care provider, those algorithms are still medically correct. So they may be, so they're still in effect that way, but not officially.
And here's a one that's speaking to the timeline in thinking about general disease prevention. Are you recommending any length of time that kids stay out, stay home if they were sent home or didn't come in because they were sick? So 48 hours without symptoms, with medication, 72 hours, any guidance there?
No, in that there's whatever's written in the regs or in caring for our children.
Okay. And there were a number of questions, thank you, Sally. There were a number of questions with regard to activities. And so one would be, say we want to go on a field trip and we have a bus that we're going to all be traveling together on, should we be wearing our masks? It seems like it seems like, you know, it sort of would go with the inside guidance, but I'd love to hear your thoughts on that.
So I think going back to what so I talked about the CDC guidance, and that's for like school district buses and public buses. So I think to be wise, it would be good to have if they're in the bus, to have them wearing masks, and unvaccinated adults.
And then, oh, thank you.
Yeah.
Sorry.
So in the short, so again, some of this, you know, using these general principles, just a lot of it, it's okay now to think it through and do the thing that makes sense. And so that does make sense, yes.
And then a couple of questions about practices, things like toothbrushing and family style meals and blowing bubbles.
Yeah. So all the requirements, the guidance has been lifted, so that's all okay. So it would be, I don't know how detailed like caring for our children gets, but it would be obvious things like, what did you do before the pandemic? And the kids have their toothbrushes. I assume they would all have their own little like glasses and like cups and spaces where they kept their personal things separate from other kids' personal stuff. So go back to that. And family meals, that would be okay too. That's all lifted. And again, then go back to basic hygiene. And if the kids have been out in the playground playing and they're coming in for lunch, have them wash their hands. People are preparing the meals, wash their hands. I know that's all part of the regulation. So back to that type of stuff.
And then there's one about social distancing. So recommendations on masking seem clear. When we're inside, they're recommended, encouraged. When we're outside, they're not necessary anymore. But can you speak to recommendations, or are there any concerning social distancing?
Yeah. So we've been thinking about that too, and it's not quite as clear on the social distancing, but again, it's because child cares are so unique, because you guys are taking care of the youngest kids, and if because they're not vaccinated, and I was thinking if you have yours, because you do already have it all set up with distancing, it seems to make sense to continue with that indoors. And then again, as much as possible, have your activities outdoors.
Brenda, if I could just jump in while you're looking for another question. Sally has referenced Caring for Our Children, which is sort of the Bible of healthy regulations in the nation, and our regulations here in Vermont are based on information from Caring for Our Children, and all folks who work in regulated childcare in Vermont have access to sharedservicesvermont.org, which links directly to Caring for Our Children. And you can get a hard copy of it, but actually I wouldn't recommend that, because if you use the online version through Shared Services Vermont, it's continually updated, and so you'd get the up-to-date version. So there's been a couple questions about the link. I put the link through Shared Services in the chat a couple of times, and folks certainly can, if you don't have approved access to sharedservicesvermont.org, Kathy and I are here today. We're happy to approve you if you go on after the meeting. I do think a lot of these questions are individual business decisions now, and I think that's the hard place those of us in this field are in. And so I think I just want to reiterate what Sally has said and Brenda said, that you're going to have to go back to your community and your boards of directors and your administration, depending on the kind of structure your program has, and decide what you want to do about some of this guidance, because it is now up to, as Sally, I heard the governor say it the other day, and Sally just quoted it, you know, what the stores have always said about no shoes, you know, no shoes, no service. This is now, and it makes it difficult. The other thing I would say before I go back out of the way and off of video is, Brina brought it up last month, Sally has brought it up numerous times today. This whole pandemic has made us think very differently about what healthy for going to work and school is. And I do think there's going to be some conversations that we all need to have about, you know, it's going to involve working with employers and businesses around what is safe and healthy to be in group care, or to go to work, or to go to school. And so these are conversations we're going to keep having going forward. As Sally said so well, this is now a part of our regular living, like measles and the flu, and, you know, vaccinations and ongoing conversations. So there's a lot of great questions. Some of these really are going to be decided by you and the administrations of your program. So I just really so appreciate the good questions and the great information from you folks at the health department.
Yes, thank you. And thank you, Luann, for making those points. I think one of the things that I would just offer as well is that like have the conversations. So have the conversations with your staff. How are we going to be respectful for the wearing of or the not wearing of masks, and understanding that some people will wear masks and they will be vaccinated, and that, you know, a lot of the understanding of who is and who isn't is really an honor system. And so you know, it may be very helpful to your families if you sort of set up a drop-off 101 as they return into your program. So, you know, here's how we're going to roll out the return, and then just be really clear with them. So we're going to, you know, you can use these entrances, and go to your child's classroom and make sure you know, do all the things that you used to do. It's been 15 months, and some of them are going to be really reassured to know exactly what to do. I think everyone's going to feel it's going to be nice to have clarity, right? And so when there's so much uncertainty, to know what to expect. And then that'll be a transition for kids, and have you know, talk with your staff about that, to be prepared also what that means for kids, have families coming back in. Sometimes there's that parting sorrow, but we know that it doesn't have to be terribly sad. Keep it brief. And so we often, you know, are the ones who are educating the families about how to do that well, but also have those conversations with your staff so that we're prepared, you're prepared for that, those moments. Sally or Elisa, if you have been looking at some of the other questions and would like to speak to them, go ahead. Otherwise, I'll just sort of keep rolling through them.
Brenda, this is Elisa. I just wanted to, I did want to respond to some of the questions, but I also wanted to just take a minute to thank you all for the incredible work that you've each done over the last 15 months, both in my role as the MCH director and also of a parent of a recently graduated kindergartner. I'm just so grateful for all of the work that you've done. I did want to respond to some of the questions that were coming in around podding and contact tracing, because I know that's a question. I wanted to assure you that contact tracing is not going away. I know Sally did mention this. We intend to continue to contact trace certainly throughout the summer, most likely into the fall and beyond. And there's actually a lot of funds coming into the state to support that work. So we anticipate that it will continue. Fortunately, the cases are in the single digits most days. So it's not quite a lift as it was in the fall or early winter. So we do intend to do contact tracing. We have this sort of new robust support to back us up. And so we believe that we're going to be able to take actually some of the work and the burden off of the programs that have been doing a lot of that work in the last 15 months. We believe that, I mean, we will certainly still need your support in trying to sort of figure out who students or who children or adults may have come into contact with, but there'll be more interviewing done by the health department contractor to support that work. We will still be asking individuals who are in close contact to quarantine, and certainly ask individuals with COVID diagnoses to isolate according to the guidance that we've been using since the start of this. It may be harder because we anticipate that people will be moving around more and be having different kinds of contact than they did earlier on in this pandemic. But none of that will go away, and the health department is still here to support your programs and centers if there are cases in care. So just wanted to add that.
Thank you for clarifying. There were a number of questions about quarantining and whether it was still going to be applied. So it's good to have that information. Let's see what else we have here. One of the things I think that continues to come up is how there's the CDD and the Department of Health and the AOE. And so I didn't know if either of you wanted to speak to that, those the differences there.
I don't know, Lisa, would you want to take that? You've been working with all three organizations at your level a lot.
Sure. So we have worked at the health department very closely with the Agency of Education and the Child Development Division over the last 15 months to support the development of guidance for both childcare, out of school time care, and education facilities. And as Sally mentioned, that when the executive order was lifted early this week or last weekend, I forget when it was, that there are ability as the health department and to the same degree AOE and Child Development Division to promulgate those that guidance shifted. So we're no longer able to put into place requirements about all sorts of practice, everything from from masking to social distancing to singing and family style meals. And so we continue to work with AOE and CDD in order to really provide support, technical assistance to the field. But as it comes down to determining sort of what the child care regulations are, or if you receive pre-K funding, how that the relationship with AOE and Child Development Division all sort of sugars out is really the health department is no longer part of that. But we certainly will continue to support best practice and support you as you have questions and things come up.
Thank you, Elisa. I think my best advice is always check if you're a pre-K partner, check with the AOE. Go to the source. It's going to be the most reliable source of information. So yes, okay. So we had some questions about requirements of vaccines, and we got to the legal piece about like, can we require staff and things, but some folks had asked different variations on the same question of, will the COVID vaccine, when available for children, become a required immunization that families would, like we already track immunizations. So would this be one that we would sort of add to the immunization list?
Yes, Elisa, I don't know if you're hearing anything that I think that's the approach that as COVID becomes one of these ongoing endemic, to use that term, infections like flu and all, there will be consideration about adding it to the list of required vaccinations. So I'm not in on any of those conversations. Elisa, you may be, I know that question is being asked, but there's no answer as of yet.
I know there were a number of the questions in there that we just can't really answer yet. I try to listen to Dr. Levine each week and hear what is being said from that platform as well. And it's the same thing, like we'll know when we get there, and we're not quite there yet. So then there were a number of questions about asking, sort of how do we know who's vaccinated and who's not? I think that the answer is we won't, and gets back to that honor system again. And so, as a program, you can say that we request that you wear a mask if you aren't vaccinated. And ultimately, we're not checking people's cards or if they have one. And so we're in that space.
Yeah. And to say, all along we've been talking about trust people do the right thing. And so many people do the right thing. But then, you guys have called our warm line and we talk, and you have this particularly, we understand that sometimes that just doesn't happen like we'd like it to. And that you have to deal with it when there's a recalcitrant parent or something.
And one of the things that I did hear Dr. Levine say, was it yesterday or the day before, was that because we're at 80+%, he said, I don't know if 75 or 85 is herd immunity status, but we're in that zone where we're actually, we can feel good. I don't know if that's the word he used, but he said, that we are approaching a place where even if someone isn't forthcoming about their vaccination status, that there is, we're getting pretty close to the risk likelihood of exposure is getting lower and lower.
Yeah.
So I was reassured by that. Go ahead.
Brenda, I was just going to say, which I can send to you and you can share. Someone just before this sent me this map of the entire US where everything was yellow except for Vermont, which was green. And no matter what you feel about all of this, it was pretty remarkable to witness.
Yeah. Let's see here.
Yeah. And we're hopeful that as this goes on, more and more people will choose to get vaccinated. I know I have a friend who was really resistant, and then there was a health situation in her family, and she had to go in the hospital a lot. And that event made her realize she needed to get vaccinated. So some of the folks who are still unvaccinated may have an event in their life that will have them change their mind.
And again, sort of like inviting people in and not knowing their status. I feel like that is part of the resourceful, like how are we, so have that conversation with your staff. What about parents who aren't vaccinated, and we're trying to figure out how to welcome families back into our program, and we're not asking people their status. And so does that, you might decide that means that you're going to continue to wear masks for a while. You may decide something else. but that is a conversation. I think there's so much value in having those conversations so that you're on the same page, that you're operating from the same place. Instead of sort of one person thinking, well, this is what we're doing, and another staff member thinking, well, that's what we're doing, and families saying, I don't know what they're doing. So talk about it, think about it together, and then communicate that. Let's see here. We have some more questions. So we're getting some thanks. So thank you, Sally. Thank you, Elisa. Thank you to Brina and Margaret as well. I want to make sure that if you didn't see that, that's coming from folks who are on this call.
Great.
And to Brenda and Chris for putting these together and the work that you've done as well. Thank you both, all of you.
So should we mention about Brina's future plans?
Yes, and then I'll do a wrap up. We have 3 minutes left together, so I'll let Sally tell you about Brina's plans, and then I'll do a wrap up with where you can find all of these resources.
Okay, great. So Elisa is our division director, and she has been for nearly a year, Elisa, yes? And 6 months. So, but Elisa has been our deputy director for several years, and she has worked very closely with Brina. And I'm saying that because Elisa is our division director now, as Brina has pulled back from that role. She's working with VCHIP and the Lerner College of Medicine with pediatric and obstetric and maternal child health quality improvement initiatives, and working with the medical students and the residents. And it turns out, as it just sugars out, that she will be officially leaving her position at the health department. So what that mainly means is that if you send her an email at vermont.gov, it'll get kicked back. But that doesn't mean Brina is unavailable. She's still here. She's still an advisor to our staff, but she's not directly available anymore that people can email her about COVID questions. But she's certainly in our community as a lead for the pediatric community. But we have Elisa, which makes us here at our MCH division not freak out that we're losing Brina because we have Elisa. So that's very comforting. And then also in the last slide, I have the phone number that you can call. And I think I said this is the it's a new, it's the people who've been answering calls all along. They chunked out the maternal and child health calls for us at our branch, and now they put them back. So they're expert. They know the answers. They know how to get in touch with us if there's a question that's particularly thorny. But if you have questions, this is the best way to get hold of somebody at the health department and get some assistance.
Thank you so much. Thank you, Sally. Thank you, Elisa, today. And thank you for having these conversations every month. It's time is up. So I would just remind you that all of the slides that you saw today will be posted to the Let's Grow Kids website within usually 48 hours. I should just say within the next couple of days, in a very reasonable period of time. We also capture all of the questions that remained unanswered. We carefully comb through the entire list each time to make sure that we actually gave an accurate answer. And we list all of the resources like the shared services and the caring for our children resources. And also we've been given permission to share some programs, Welcome Back Family rollout. So, if you want some sort of generative ideas to get the juices flowing for what you might decide to do. And so thank you for making the time, for taking the time, thanks for being there for the children and the families. And I wish you clarity of mind, some joy in every day, and maybe a big sigh of relief that we're emerging. And you did it. Like, I know it seems trite to say you did it, but you did it. Thank you.
Great. Thank you.
Have a great afternoon, everyone.
Bye-bye.